This is the human side of healthcare, where we explore all aspects of today's ever-changing healthcare environment. Brought to you by the Dallas-Fort Worth Hospital Council and featuring CEO Stephen Love with co-host Thomas Miller. Now, let's make healthcare human again.
Welcome to the human side of healthcare. We're delighted you're with us today. And we've got Dr. Bibas Reddy with us, who's a medical oncologist at Medical City Healthcare. And we're going to be talking about sickle cell disease. Dr. Reddy, welcome to the show.
Thank you for having me, guys. I appreciate the chance to talk about blood and cancer disorders and always share information with the public. So I appreciate the opportunity to be with you.
You know, for our listeners that may not be familiar with sickle cell disease, could you give a brief background, please?
Sure. Sickle cell disease is a group of inherited red blood cell disorders that affects hemoglobin. That's the protein that carries oxygen throughout the body. So this condition affects about 100,000 people in the United States, and worldwide affects about 20 million people. Normally, your red blood cells look like the disc, and they go through the bloodstream, and they're flexible to be able to get through the bloodstream. But when you have sickle cell disease, they're not nearly as flexible, and they're sickle-shaped. And so what happens is they basically get caught in the small blood vessels and cause issues like pain crises, strokes, or other episodes of infection and eye problems.
You know, you mentioned in the U.S., roughly 100,000 people are impacted by this. Who would you say is the most affected by sickle cell disease, and do you know why?
Typically, it's affecting patients who are of sub-Saharan African descent, basically African-American patients. It can affect people from other parts of the world, like Mediterranean countries, some people from Saudi Arabia and India, and even South America. But basically, it's an inherited disorder, meaning that it runs in families. So patients inherit a sickle cell gene from each parent, and this is called hemoglobin S. And so those are the patients that are typically affected.
So what would be some of the most common symptoms so that someone would know that they do, in fact, have sickle cell disease potentially, and how do you diagnose it?
Well, fortunately, in the United States, we have a strong screening program. So every baby who's born is tested for sickle cell disease as part of a screening program. In newborn screening programs, blood from the heel is pricked, and we actually do a spot test on special paper. This is sent off and analyzed, and then people who have positive results are passed on to their primary care doctor with these results so that they can be followed and monitored moving forward.
With sickle cell disease, is that something you deal with for a lifetime, or is it a way to cure it?
It is a lifetime diagnosis, and for children as infants, they normally have fetal hemoglobin that is a predominant type of red blood cell, so they aren't as affected as bad in their younger ages, but as this becomes more predominant and as they get older and the hemoglobin S variant is becoming more predominant, that's when we start to notice the pain crises and more of the issues that affect sickle cell patients.
You know, you mentioned in your answer the word crisis, which prompts a question. What is sickle cell crisis?
Of course, and that's a very important question. A sickle cell crisis is a painful episode that occurs in people who have sickle cell anemia. What happens is the sickle-shaped red blood cells obstruct blood vessels, and when blood and oxygen cannot get to these tissues, patients suffer pain. A sickle cell crisis can damage your tissues and even cause organ failure like liver or kidney failure. Most patients, when they have a sickle cell crisis, though, notice bone pain, and they talk about pain in various long bones or any bone throughout their body due to the obstruction of blood flow in the bones.
You know, when a patient is diagnosed with sickle cell disease, what are some of the different forms of treatment?
Well, first off, sickle cell patients require comprehensive care, and this is a team approach, including hematologists and primary care doctors and infectious disease doctors, and of course, healthcare providers and hospitals that help with these patients. And so comprehensive care is important. And one of the mainstay of treatments that we're able to offer patients is a drug called hydroxyurea. What this does is reduce pain and other vaso-occlusive complications, helps decrease hospitalizations, and improves these patients' survival. There are other options for patients who can't tolerate hydroxyurea also. Another important treatment option is blood transfusions, and this is important for patients who are going through a certain sickle cell crisis. It's also important for patients who have a critical condition called acute chest syndrome, where they have impaired oxygenation in their lungs due to a sickle cell crisis. Also, sometimes in patients who are being prepared for surgery, we can use transfusions to help prevent complications during surgeries. So blood transfusions also are important. And then also things like nutrition is important, involving nutritionists. These patients need to have adequate nutrition because they have a chronic hemolytic anemia, meaning that their red blood cells are being broken down due to their sickle cell crises. So these patients need folic acid, multivitamins without iron, vitamin D, and calcium replacement. So having nutritionists involved is important. Pain management is very important. That as these patients are undergoing pain crises, not all need to be hospitalized. All these patients want to be productive members of society, and so sometimes they can manage their pain at home with oral pain medications and the help of pain management doctors. There are unique situations like bone marrow transplant, which can help cure patients, but bone marrow transplant is not appropriate for every patient, as it's a very complex process with risks involved with bone marrow transplants and potential complications from the actual process there. Gene therapy is being investigated, and we're hoping in the future that this cutting-edge technology might be able to help these patients even more. But this just goes to show that treatment of sickle cell disease is truly a team approach, and it's not any one physician or medical provider that's doing it all.
You mentioned in your answer blood transfusions. How do blood transfusions and other blood products help with sickle cell patients?
So blood transfusions are a significant role in management of patients with sickle cell disease. And for patients who are admitted to our local hospitals, blood transfusions help improve their crises and shorten the degree of pain and the amount of time required for hospitalization. Also in patients who have critical conditions like we talked about, like acute chest syndrome, it can help reduce the risk of death for those patients. And so blood transfusions play a key role in reducing these complications. And also some patients benefit from a type of treatment called exchange transfusions, where they get regular blood transfusions that give them healthy red blood cells and remove the sickle cells to help decrease their hospitalizations and other complications that can occur with sickle cell disease.
You mentioned the use of blood products in the treatment of sickle cell disease. Thomas and I know blood drives are important. This just underscores the need. Would you agree?
I definitely agree with that. Sickle cell patients oftentimes need packed red blood cell transfusions, and so blood drives help us to help these patients. And during the last few years, which have definitely been challenging with COVID and coming out of this, that we need more than ever for patients to get out there and donate blood to help not just sickle cell patients, but patients with many other disease processes like cancer and surgeries and accidents and things like that. So it's important for folks to get out there and donate to help not just sickle cell patients, but every patient out there that may need blood products.
We're listening to Dr. Bibas Reddy from Medical City Healthcare talking about sickle cell disease. This entire interview is on our podcast, the Odyssey app, and YouTube channel. And when we come back, we're going to step into the new realm of medicine, genetics. Is it applicable to sickle cell disease? We'll find out next.
This is the human side of healthcare, where we feature healthcare's hottest topics and what our North Texas area hospitals are doing to make healthcare human again.
Welcome back. We're going to continue our discussion with Dr. Bibas Reddy as he continues his discussion on sickle cell disease. And I know as we look to the future, do you see, Dr. Reddy, gene therapy, say in the next 5 years as being cutting edge?
I think the timeline on that may be a little bit longer than 5 years. We're trying to figure out how to utilize gene therapy to ideally cure patients, but it is by no means mainstream yet. But we're hopeful in the coming years and next few decades we can find treatment options that will cure these patients of this devastating disorder to try to help them lead the long, healthy, productive lifestyles that they want to lead.
For individuals that have sickle cell disease, as they do family planning, is there anything special they should do prior to conception?
Also very important because for patients who have sickle cell disease, if they're talking about family planning, we'd like for their partner to also be tested so we know if the partner has hemoglobin S disease or not. And that's important because if the other parent does not have it, then it is unlikely for these patients to develop sickle cell disease, and also allows them to have children with less worry of having the complication.
If you're not born with sickle cell disease, can you develop it later in life?
No, because you're born with it due to a genetic mutation. When you're born, you either have it or you don't. So it's not something that you would inherit later or develop later on.
You know, I've always heard sickle cell anemia. Is that different than sickle cell disease?
Sure. Sickle cell disease actually covers the spectrum of sickle cell patients, and there are some patients with SS hemoglobin genetic findings and other patients with more milder variants, and so it does cover the entire spectrum of the disease process when we say sickle cell disease versus the generalized term of sickle cell anemia.
Dr. Reddy, this is Thomas. I just was looking at the CDC page. It says 1 out of 365 African American births. It seems high to me.
It is, and if you would, if we look at the whole spectrum of disease, patients with milder variants versus the true double recessive gene, it does encompass a large number of patients, and that's why screening at birth is so important for us to diagnose these patients early on so that they can get comprehensive care at pediatric centers initially, and then transition their care to adult hematology follow-up.
Now, one thing we didn't discuss is both race and gender. Can you address both of those for us?
It is typically affecting African American patients, but there are smaller populations in certain countries that can be affected. But in regards to gender, it affects both males and females, and really is based on genetic makeup at that point.
What about mortality rates?
So sickle cell disease can shorten the lifespan of patients with many complicating factors. Some of the biggest ones are that as patients have crises in the spleen, it makes them what's called asplenic, and our spleens help us learn to fight infection and ward off serious infections. And these patients basically lack a spleen at that point later in life, and so it puts them at higher risk of infections, and that's why things like vaccination for pneumonia and even COVID is very important for these patients to reduce the risk of life-threatening infections. Other complications like acute chest syndrome can shorten one's life due to the effects on the lungs and the critical nature of that diagnosis. In addition, risk of things like hospitalizations and complications that can sometimes happen to patients during their hospital stay, like pneumonia or other infections or possibilities. And so it's important that we try to treat these patients with a comprehensive approach to extend their life and decrease mortality as much as possible.
And then what kind of lifestyle do they have on this journey?
Every patient is different and every patient is an individual. The goal is to have these patients continue to be productive members of society. I have patients who maintain employment, other patients who attend regular schooling like college, and can lead very regular lifestyles with occasional episodes due to sickle cell crises. And other patients have challenges that happen, such as frequent crises or infections that require hospitalizations, and it can significantly impact their quality of life. And requires true compassionate care to help these patients during that time.
Dr. Reddy, if someone's diagnosed with sickle cell disease, is there a possibility it could lead to other disorders such as leukemia?
No, it's not. A complication of things like leukemia would not be expected in these patients. It doesn't cause that type of effect on the white blood cells or the bone marrow in that sense.
I know that stress has such an impact on all of us, and especially if we have a lowered immune system, it can increase that. How does stress factor in, and do you advise patients specifically on how to treat it?
Well, for patients with stress, there are things they can do to mitigate crises, things like adequate hydration and preventing themselves from getting dehydrated because that causes complications with blood volume and could increase their crises. things like nutrition and maintaining a well-balanced diet can help reduce risk of crises. Unfortunately for all of us, stress is a part of normal life, and trying to do the best for these individuals as they work through that, including college education and challenges with work and things like that. But trying to work around the stress and minimize any other factors would be the best approach, I think.
And is this an area that hospitals or even private organizations offer support and support groups for?
Definitely. And, our pediatric partners have pediatric clinics for patients that are diagnosed at a young age to help them as they go through the sickle cell disease and changes that happen until age 18. And that's when we transition to adult hematology follow-up after that. And, of course, the healthcare providers that we have at hospitals are there to assist us for patients who have acute crises that require hospitalizations for pain control or blood transfusions. And so it's important to work with all of our community partners during that process.
Excessive weight, can that affect this?
Well, if we consider that excessive weight goes in with diet and exercise, it definitely could complicate that. And maintaining a healthy weight and diet is the best approach. Unfortunately, for many of these patients, due to the lifelong illness and the disorder, we don't see as many patients that are overweight. Most patients are actually underweight, and so focusing on adequate nutrition for these patients is very important.
I'm seeing on this CDC website that preventing infections is a common theme. Is that kind of the big deal for people with sickle cell disease?
Because they lack a functional spleen due to crises and infarctions in the spleen, they're at risk for serious infections like pneumonia and meningitis, and those are disorders that we can vaccinate against to try to help reduce that. And it's important that we ensure these patients receive regular vaccinations, including hepatitis B and influenza and pneumonia shots.
I know for physicians and providers, patient compliance is always a big deal, where a doctor lays out a plan, and then patients, we have to follow that plan if we want the expected outcome. What about that if you have sickle cell disease?
It's important for patients to maintain follow-up, especially for patients on hydroxyurea, to help ensure that their blood counts are staying safe and that they're doing well on treatment. Sometimes the doses of hydroxyurea can be titrated up or down to help with reducing the risk of crises. So compliance and follow-up is very important.
And what kind of frequency is that blood monitored?
For patients who are doing well with their sickle cell disease, we can see them as infrequently as every 3 months because they're coming in for just regular checkups. For patients who have more frequent issues, sometimes it may require follow-up, say, once a month for exchange transfusions or other monitoring for like pain medication and hydroxyurea management.
Dr. Reddy, this has been so educational. I learned from you today. I always thought of it as predominantly African American, but you mentioned Middle East, South America, India. This is truly a worldwide disease. So thanks for helping educate.
It is normally affecting African American patients, but there are smaller subset populations in the world that can be affected. But in the United States and for most patients that we see, it is predominantly African American patients that are unfortunately affected by this.
Dr. Reddy, you've given us great information today. We're going to give you the final word. What message do you have to our listeners regarding sickle cell disease?
So sickle cell disease is a challenging disorder for patients that are having to deal with it their entire life, and unfortunately it does shorten their life. But the important thing is for us to find these patients early, to help manage them, to try to help them lead as healthy and productive lives as possible. And if done correctly, patients can add years and decades onto their life. They require comprehensive health care that will help them get through this and improve their health in the future. Now, there are exciting things that are coming down the pipeline. We're not there yet, but I think in the meantime, as healthcare providers, it's important for us to care for these patients until we can find the next best thing, like gene therapy, to ideally find a cure for these disorders.
Dr. Bibas Reddy from Medical City Healthcare, thank you so much for your thoughts on this life-altering disease. Now, when we come back, you didn't have to tune in here to find out that it's hot in North Texas, but we are going to find out what we can do to prevent heat stroke next on the human side of healthcare.
Welcome back to the human side of healthcare, where we explore how to take better care of your health so you can live a happier, healthier life. With DFW Hospital Council CEO Stephen Love, along with Thomas Miller.
Welcome to the human side of healthcare. Delighted you're with us today. Hey, how about this Texas weather? My goodness, it's been hot, especially early here in the summer. We want to talk a little bit about heat illness and some of the problems associated with heat, including exhaustion and stroke. We're delighted that we've got with us today Dr. Amrita Nanda, who is with Medical City Las Colinas and serves as an emergency medical physician. Dr. Nanda, welcome to the show.
Thank you so much, and thank you for having me.
You know, to kind of set the stage for our listeners, I know they know when you get hot, you get heated, etc. Can you walk us through what you perceive as heat illness?
Sure. So just like you said, this year, especially the heat has been coming to us a little bit earlier than usual. On our side, when we think of heat illness, we actually think of it more in stages and symptoms that you can get from the severe heat and with increased exertion and exercise. And those symptoms can progress from mild to serious. So like you said, heat cramps, heat exhaustion, heat stroke, those are kind of the three platforms that we use to determine and see how severe the heat illness is.
So then how do you scale those three stages?
So like I said, we look at these stages usually from mild to serious. So we'll start with the mild. The most mild we see is usually what we call heat cramps, and it's exactly what it sounds like. It's mostly when people or individuals are doing strenuous exercise or working outside for long periods of time in the heat, and they essentially get spasms that are involuntary in the muscles. They could be very painful. So mainly it's muscle cramps, but the other things that we see with this is heavy sweating, fatigue, thirst. And we always say if you're thirsty, you're already behind on your hydration. So the main treatment for heat cramps is to stop the exercise or stop the strenuous activity. And when we say stop, we want you to do that for several hours at a time to let that cramping subside. You want to allow your body temperature to come down, find air conditioning, or if you're still outside and can't get to the air conditioner, to get under some shade to avoid that sunlight. And then obviously the biggest thing is to rehydrate. So whether that's water, it's any sports drinks like Gatorade, Propel, anything with electrolytes in it. We want to allow for those fluids to rehydrate and not allow those muscles to relax. Can always try to stretch and massage those muscles, but that can initially be a little uncomfortable until you get well hydrated. And then obviously, although that's mild, if those cramps aren't going away within an hour to 2 hours after doing those treatments, we always ask that you get medical attention to make sure that you're not progressing to the other stages. So that's usually the mildest form. And then we go on to think of heat exhaustion. And that's a little bit more serious. We see that more once we've gotten past the cramps. So you have the cramps, but you also see these kind of the heart rate starts to increase. Or if it's severe heat exhaustion, you can start to slowly decrease in your heart rate, your blood pressure, feel faint, feel like you're going to pass out. We see a lot of headaches and dizziness, nausea, vomiting. Again, absolutely, we want to stop all of the activity, come to complete rest, find a cool area, rehydrate, and then give yourself an hour or two. And of course, if the symptoms are still not going away, then seek medical attention. And then the third, and I would say the most emergent, especially for me as an emergency physician, is heat stroke. And that's when the body temperature itself is above 104 degrees. And the biggest thing with this is you get all of the symptoms that I stated before, but sometimes here you actually don't have that sweating that we normally see. You get flushed skin, but most importantly, the stroke part of it. So we see stroke-like symptoms. So speech problems, confusion, seizures, the worst form is coma. So if you have a family member or friend, you want to get them immediate attention, call 911. And while you're doing that, get them in the shade, get them cooled off. If you've got a hose or water bottles, get all that water on them, get ice in their armpits, their groin, their neck, anywhere into the core of the body to start bringing down that temperature and make sure you get them to the closest ER as soon as possible. So those are really the three stages that we, on our end, we are the most concerned about in the treatments that we recommend.
If you're dealing with someone that you fear is having heat stroke, should you elevate their feet and legs in any way, or should you elevate their head, or is that something you don't really worry about at that point?
So you can. I think the best, if anything, maybe elevating the legs to get that blood supply back up to the heart if there's a concern that their pulse is low or their blood pressure is low. But truly, we want to get that body temperature back down, especially if they're over 104. So if you can do anything first, it would be to go get some ice, some cold water, anything cool to get on their body. And then while you're doing that and waiting for those paramedics to show up or someone to get the patient to the emergency department, elevating those legs is a great idea.
We're listening to a conversation about heat and heat stroke with Dr. Amrita Nanda, emergency room physician at Medical City Las Colinas. This entire conversation is on our podcast, The Human Side of Healthcare, the Odyssey app, and our YouTube channel under the same name. Steve?
You know, many people in Texas make their livelihood working outdoors, especially during the summer. What are some of the things that you recommend to help prevent heat-related illness?
Sure. So that's a great point, especially, people who work outside, they can't avoid doing that, or children who are at camps during the day outside. So the best part about heat-related illnesses is it's the best medicine is prevention. So I know a lot of us think we're not thirsty, we don't need water, but we do. We need that hydration. So even if there's not, an air-conditioned room, if you have water on you and it starts from home before you even leave from work, get yourself well hydrated, make sure you don't leave the house without water. Make sure you know what the temperature for the day is going to be so that you take frequent breaks during the day, especially during the peak of the heat. And then, the best thing that we also recommend is dress lightly. So, light colored clothes, lightweight clothes, make sure you have a hat on you so that sun's not directly in your face. And then, just make sure you're checking on, your coworkers and friends and family who may be a little bit older or younger that may be out in the heat. But hydration and keeping well covered and dressed lightly are probably the biggest tips I could give.
Are there some individuals that are really just more prone to having heat-related illness than others?
Yes. So like I mentioned, particularly people over the age of 65 and young children tend to become dehydrated more quickly. And part of that is they just aren't well hydrated to begin with or don't feel thirsty. But people who are not as familiar with the heat, especially this Texas heat that we have, illegal drugs and alcohol can also decrease hydration status and increase the core body temperature, making them more prone to become dehydrated or susceptible to these heat-related illnesses. And then weight is another part of it too. People who are a little bit heavier set just require more hydration and may not be as used to as strenuous heat and activity in the heat. So those are usually the more prone age groups and other status that can cause heat-related illnesses.
As you described the different stages, of course, as you got into heat stroke, it's one of the most serious. But I've heard when you have heat stroke, it can trigger other serious medical conditions.
Sure. And I'm sure it's been commonly heard rhabdomyolysis or rhabdo is the short form of it we use frequently, which can happen even not in the heat, but particularly that one can be the most dangerous that we see. And not only the stroke-like symptoms that you get, but once you start getting that muscle breakdown, the muscle tissue starts to die. And that protein that comes out of that dying muscle is called myoglobin. And that can be very dangerous because when it gets into the bloodstream, particularly the kidneys are the ones that filter out that protein, but the kidneys are only used to so much of that protein. And so after time, it becomes difficult for that filtration process to happen and the kidney cells can die off. And so we do see people get these severe muscle cramps. Their urine will look coffee colored or dark colored. They can have even worsening of those stroke-like symptoms. And so that's particularly one thing that we can see that heat stroke and heat illnesses can lead to. But that also goes for people who are, bodybuilding or exercising. We tend to see that. So that's why that hydration is so important to keep those muscles from breaking down. But that's usually one of the most serious conditions we see from heat strokes.
Dr. Nanda, I worked outside in the yard this weekend. My T-shirt got soaked, so I was perspiring quite a bit. If you don't perspire, is that a symptom or sign that you may have an issue?
Yes, it very well could be. One thing, it means that maybe you need to hydrate yourself more. But in that heat exhaustion period, so once we're past the heat cramps, we actually see that people get this cool, moist skin, they get these goosebumps, and they actually don't sweat. So if you're starting to notice that maybe you were sweating before and not so much, and you've still been doing the same activity, same amount of heat, or you're not sweating, then, we want you to take that as a cautionary sign to get out of the sun, you get in the shade, take a break, get some water, get some, like I said, the electrolyte containing fluids in your body, and give your body some time to regulate its temperature before going back, even if it's just doing some yard work for a few hours.
Dr. Nanda, what would you like to convey to our listeners about heat-related disease so that as they go through this summer, they heed your advice?
Sure. I think I would tell you we're already seeing it. I've actually seen it my last couple of shifts. And so the heat is hitting us sooner this year and harder than usual. So I think if the one thing I can tell you is that hydration is key, keeping yourself aware of the temperature for the day and the times of the day that it's going to be the warmest. And I remember when I was younger, they would always tell us, if you're thirsty, it's too late. So make sure you're not even at that point and you start your day off with being well hydrated and keeping those waters, bottles, and fluid with you throughout the day to keep yourself from getting any sort of heat-related illness.
We're listening to Dr. Amrita Nanda, emergency medicine physician at Medical City Las Colinas. More tips coming up on how to stay well in the heat. We also have this whole interview, plus our sickle cell interview, on our podcast, The Human Side of Healthcare, on the Odyssey app and on our YouTube channel. We'll be right back.
Covering the healthcare topics that matter most to North Texas. This is The Human Side of Healthcare with DFW Hospital Council CEO Stephen Love, along with Thomas Miller.
Welcome back. We're continuing a very relevant conversation right now as the heat bears down in North Texas. Heat stroke and how do we prevent it? We're talking with Dr. Amrita Nanda. She's an emergency physician at Medical City Las Colinas. Dr. Nanda, what we were talking about in the last segment, is staying hydrated really the bottom line point?
I would say so. To me, and in general, when we see it, people, by the time they develop these symptoms, it's already too late, and it's because they haven't been keeping hydrated. I think mostly just not expecting it to be as warm and how much we lose over the day when it is this hot out.
When do you normally start seeing people in the ER?
Usually we tend to see, heat illness, especially in Texas, closer to July and August when it's the hottest, I would say. But I will tell you this year, we're seeing it a lot earlier than we have in the past. No heat stroke, luckily, but a lot of heat exhaustion and heat cramps here in the last few weeks.
When does this become fatal?
I think if we are starting to see those heat stroke-like symptoms, then we are in trouble because when we're seeing stroke-like symptoms, we're seeing the body at the point of dehydration to where we're having to give these patients significant amount of fluids to even get them at a state of having a normal mental status. So I would say if you're starting, like we talked about earlier, starting to get these cool chills, or you're starting to get a little bit of a headache or nausea, you need to take that very seriously, get out of the heat, take that day off, get yourself well hydrated. But if you're starting to have neurological symptoms or even that headache, that's our first sign that we need to take some action.
And what role does humidity play in all of this as far as our body's susceptibility to these complications?
Sure. So we think of, body temperature in general. We talked about heat stroke when that body temperature goes over 104, but humidity tends to make us sweat more in general. So we're losing a lot of water volume from our body when we sweat like that. So I would say when the humidity is up, we need to be even more cautious about that light clothing and drinking more fluids. So in Texas, luckily it seems like we have a little less humidity and more of that dry heat. But nonetheless, we do have to think about that humidity and keeping ourselves well hydrated for all the sweating we're doing. We have to be able to kind of replenish that water supply in our body.
I'm thinking about this consumption of water. If you drink a lot of water, let's say you drink a gallon of water and you don't have to go to the bathroom, what does that tell you?
Well, that's not good. If you're drinking a gallon and not able to urinate, that means that, and of course, you're exactly right. It's based on height and weight, and we never want you to, get water toxicity and drink too much. But you should be urinating. If you're not urinating, that means you're still dehydrated, and that's usually the sign we also use in the ER. If we're giving you 1 to 2 liters of fluid and you still haven't been able to urinate, that means we haven't done our job right. So you should be, frequently using the restroom so that we know that you're well hydrated, your kidneys are getting good perfusion and good fluids. So, if you're drinking a gallon and you're not urinating, we know you're a little bit behind. So you want to keep up with those fluids until you're able to go.
I know there's a story out there on the street that if you've had heat stroke, you never respond to heat the same way. Your thoughts?
I'm not so sure about that exactly. I would say that I know people who've had heat stroke, they never want it again. So they tend to be very cautious in the heat. It depends on how severe the heat stroke is. Like we talked about, it can be fatal. And so, particularly the kidneys get affected the most. So people react differently over time as far as hydration. But probably true, I would say, from what you're asking, but
with variables, right?
Right, exactly.
Steve was mentioning doing yard work, and Steve is, he's seen a few birthdays, just a couple. I have 2. So as we get older, when do we need to really think about what we can and can't or should and shouldn't do in this heat?
Well, I think we all know when our body is changing, but we obviously have the age limits. We always say 65 and older is when the body really starts to change, and we have to kind of face that truth and that reality that we tend to get dehydrated faster. Just doing more strenuous activity is just harder in general. And so you put your body through a bigger toll. That goes for the very young also. When you're very young, you think you can run around and do all these things and not drink water for hours or not take care of yourself. But that's when these things tend to hit you. So I would say that if you are starting to feel run down, even if, you're still sweating and you're taking in water, take that break, because you don't want to get to that point where, you're just feeling miserable and you're already behind. So I think some of those symptoms that you feel on a day-to-day basis, whether it's feeling a little bit worn out or just kind of achy, or, you got to listen to your body and take that minute to step back and kind of reassess and take a little break from what you're doing.
Now, let's say that somebody has diagnosed heart disease of some type. Maybe it's fibrillation, they've had some kind of blockage, but something has happened with their heart. They need to be extra careful too, yeah?
Absolutely. And, most of the cardiologists will have these conversations with, their patients, particularly that have these heart conditions. But we do see, like I mentioned earlier, the blood pressure can drop, your heart rate can initially increase and then drop significantly, just purely from the heat. And so I think really being conscious of your own medical history and the medications you take, and knowing what time of the day to do some of these activities. We want you to be active. We want you to be out and enjoy the weather while you can. But, maybe taking that bike ride later in the evening, when maybe the sun is coming down, or earlier in the morning when the temperature is not in the hundreds, but maybe in the 80s, and taking frequent breaks, I think are very important. And again, like you said, listening to your body is key. But, following up with your cardiologist or your primary care doctor is very important, especially during this time of year. But just being conscious of what the weather of the day is going to be and how much your body can handle is very important.
Now, you're talking about hydrating. Straight water, electrolyte drinks, or adding electrolytes to water?
So water is always number one, but I personally am a big advocate for these kind of electrolyte-containing drinks, whether that's Gatorade or Propel or, those even packets of electrolytes you can put in drinks. One, they just make the water taste better and encourages us to drink more of the fluids. But like you said, they contain those electrolytes, those things that are important for our body, for our muscles. People tend to just purely have muscle cramps when their potassium is low or their sodium is low. And so those electrolyte containing fluids not only taste good, but they increase and help keep our electrolytes at that normal level. So I would say a good mix of both is important, but purely one or the other. I would say if we're going to pick one, I would go with water, but a mix of both is always good.
Okay, I'm curious about this. So somebody comes in, they've had a heat issue. What then happens in the emergency room? What do you do at that point?
Sure, absolutely. So, actually last week I had a patient who does landscaping, and a young guy, and not even, I believe he was in his 30s, came in, had been working out in the 100-degree heat all day, got home, was speaking to one of his friends, and all of a sudden started feeling nauseous and sweating, and then got the goosebumps, and then had vomiting and severe headache. So his friend did the exact right thing, ran inside, called 911, grabbed some cool towels, got it on his forehead, and they brought him directly in. The paramedics are well trained for this, so they were quick on their end, and they put an IV in, and they started cool fluids, got this gentleman kind of pretty much down to just his t-shirt, and got him into the ER quickly. By the time he got to us, what was very helpful is usually we know that these people have been out in the heat. We'll get a good story. So our nurses get a second IV in, start those cold fluids. We get nausea medicines in. We do our best to kind of strip down the patient so that we can get them cooled off, get them all the medicines for headache and nausea. And I think within an hour to 2 hours, he was a new man. He felt much better. And we actually used, like we talked about earlier, kind of his urination status or his urine output to determine if we had gotten him fully hydrated. And I believe after 2 to 3 liters, he was able to urinate. He was able to ambulate. His headache had resolved. He no longer had any vomiting. And then we had a very long discussion about keeping himself well hydrated in this heat. But that is what we do. The paramedics are trained to do that. We're trained to get IVs in quickly and get fluids and medications to get these people feeling and looking better quickly.
Great conversation. Dr. Amrita Nanda from Medical City Las Colinas, thank you so much. Steve?
Thanks for joining us today, and we really appreciate our guest. And don't forget those blood drives and giving blood during the summer. And by the way, have a safe and enjoyable upcoming 4th of July weekend.